Okay, humans, here are a few cases with acupuncture, moxibustion, and or bleeding. But one of the things I want to point out is that most, although not all of the cases today, use herbs, herbal medicine, along with acupuncture, moxa, and or bleeding. There's kind of a myth that in the old days, acupuncturists were acupuncturists and herbalists were herbalists, and that they didn't use the other modalities. It's just not true. There's so many cases, there's so many doctors who wrote about using all of the tools that are available. So let's look at some of these cases. So this, yeah, an old lady named Ms. Shu from some place in China suffered fright phlegm. So a phlegm condition that has fright, or a fright condition that made phlegm develop within her. In the beginning, her hands and feet trembled. So sorry. She cast off her clothing and ran around naked, sometimes singing and sometimes crying. Sometimes she was led about like a dancing puppet. Unskilled doctors saw her sticking out her tongue and thought she suffered delusions from ghosts or demons. But a doctor named Johann Ching pricked the tips of her 10 fingers, Shushan, and as soon as they bled, she was back to normal and at ease. Okay. That one doesn't have herbs. Actually, I don't know anything about this doctor. I should have looked him up first, but okay. So now this Dotsai is a really interesting doctor from the Southern Song Dynasty, and he wrote a book called Bianchui Xinshu. He thought he was a reincarnation of Bien Shui, or he thought he was channeling Bien Shui, a famous legendary doctor in the Warring States period. So yeah, he also liked really, really hot herbal formulas, and he liked moxa. He was just really into strengthening yang in the body. And but he didn't use acupuncture. He didn't talk about acupuncture much. I think he talked about bleeding here and there. Anyway, here's a case. There was someone who ate and drank cold things during the hot summer months. This damaged the person's lung qi and resulted in cough with inhibited chest and diaphragm. So it's like his breathing was difficult or felt labored. Um, he first took 100 grains of jinye dan. So this dotsai has a lot of dan formulas, which are usually have heavy minerals and metals and toxic stuff that we're not going to use today. So jinye is like Jin is golden and Ye are of Jinye humors, Jinye fluids, but this Jin means gold. It doesn't mean the Jin of fluids. Anyway, whatever. So he took, this herbal formula that we're not going to use today, and then he had a bit of diarrhea and the pain decreased by 30%. But not good enough. So then he took Wugusan, which is another formula that we're not going to take, and was at ease. However, he was aware of frequent reoccurrences, and there was another big recurrence after 5 years. So he's coughing again and so forth. So I applied 500 cones of moxa on lung one. And he was a big moxa user. He used a lot of moxa. But as we've seen in another case recently, that when they did hundreds of cones of moxa, they didn't do it in one sitting unless the patient was about to die. They would do 30 cones a day for 10 days or 50 cones a day for 10 days. It's still a lot, but they didn't do 500 cones in one day. Okay, so I applied 500 cones of moxa on lung one, and then there was extremely smelly flatulence that was disagreeable to the smell. I don't know, is any flatulence agreeable? But anyway, from then on, there were no more reoccurrences. Well, I don't have much to say about this. Of course, cough is lungs and large intestine is are metal. So these, it's metal related and cold things during the summer months. How does that eventually result in flatulence that gets rid of the problem? I don't know. But sometimes I'm like a 10-year-old child and okay, here's a case on flatulence. Ha ha ha. Anyway, okay. And then another case in Mingi Lei'an, which is categorized cases from famous doctors, collection of case studies from collected in the Ming Dynasty. And this has a case of Liu Qianfu, who's also named I can't say that, Liu Qianyi, who was a follower of Li Dongyuan and a follower of somebody named Do Hanqing. We saw the previous doctor that didn't he have Hanqing in his name, but it wasn't Do Hanqing. Anyway, so this is a Yuan dynasty doctor. He treated somebody with a high rank named Yang, Mr. Yang, with a high rank, who was more than 70 years old. He suffered long-standing wind phlegm. So that's internal wind and phlegm. During the spring, he suddenly became ill with spinning head and darkened vision. So, in the West, we say spinning room, the room is spinning, like if you drank too much or something like that, but that means vertigo. In Chinese, they don't say spinning room, they say spinning head. But, the room isn't spinning, the head isn't spinning, nothing's spinning. It just feels like it's spinning. So, this is vertigo. So the wind is rising up and carrying phlegm with it and making vertigo, and his vision is getting, like when he has episodes, then his vision is dimmed. He couldn't see anything. His heart shen, his spirit, was confused because phlegm confuses the heart, you know, confusion, delusions, hallucinations. He would suddenly feel the urge to vomit, but he never vomited. And he felt anguish in his heart. That's really emotional anguish. That's some kind of sensation that's mentioned in Shanghan Lun. Anyway, his head was painful all over. It was slightly swollen and red. His cheeks were also red, but his feet and legs were cold. So all this yang is rushing up with the wind, and his head is hot, but his feet are cold. You know, Going back for like more than 2,000 years from now, not from this, there was a idea that was commonly discussed in different terms, but it's even found in the Mawangdui manuscripts from like 168 BCE. And it says that the sage should have a cool head and warm feet. But here he has cool feet and a warm head. It's the opposite of what you need. Of course, yang and yin separating, yang tends to rise up and yin sinks down. So there's the cool feet and the warm head. But if you have a cool head and warm feet, that means yin and yang are interacting with each other and not separating from each other. Well, Dr. Lo said this is because he liked to drink wine in his youth. It caused all of that wind phlegm in the end. Damp heat accumulated internally after a long time, and then wind phlegm developed internally with heat above and cold below. Yin and yang failed to communicate with each other. This is the image of Pi Gua, which is this hexagram 12 that has earth below and heaven above. It may sound correct to you to have heaven above and earth below, because that's kind of what it looks like out there if you look out your window. But what happens is heaven is yang and it rises up, and earth is yin and it sinks downward. So if you have the yang rising up and the yin sinking downward, they don't interact with each other. And it's like yin and yang are separating. But if you have earth above and heaven below, that's hexagram number 11, taigua. And that has earth above, and earth will sink downward, and heaven below, heaven rises upward. So now they do interact with each other. Okay, but he's got the opposite. He's got the hot head and the cold feet. So that's yin and yang separating. He says, he continues, even though the classic, which means Neijing, generally speaking, even though the classic says to treat heat with cold, and even though a skilled carpenter cannot make a straight line if he abandons the inked string, like the, what do you call it? Where you have ink on the string and it presses against something to make an absolutely straight line. Anyway, but there are near and far diseases, and we treat severe and mild cases. He's saying, even though like there's certain straightforward things that, principles and so forth, but not every case is the same, and some cases are tricky. So this assistant grand counselor, he's old, his chi is weak. Even if upper body heat is exuberant, how could he use cold prescriptions that would further harm his spleen and stomach? Because, if he wants to clear heat using cold herbs, well, but that's going to just there's already cold below, and it will injure his spleen and stomach. His chi is weak, and that's just going to basically kill him. So the classic says, use the bien stone on heat. Again, that should be quoting from Neijing. I didn't look up the quotes. I probably should have. But the bien stone is this sharpened stone that was used therapeutically to cause bleeding or to lance boils. And you just take the sharp stone and go whack. And then the abscess is opened up, or the, person bleeds. And so he interprets that as telling him to use a 3-edged needle to prick, to bleed more, and he did it on more than 20 sites. That's a lot of blood on an old deficient patient. But the blood that came out was purple, and that means stasis, blood stasis, shaped like dewdrops, little beads of blood that came out. And in a short while, the patient's head and eyes were lucid, and all of his symptoms had decreased. Okay, so he bled, that moved blood, that maybe removed some blockage. And then Luo Tianyi arranged a formula with and the following herbs. So again, we can see here's a case where herbs and acupuncture or bleeding or moxa are combined because ancient doctors used whatever tools they needed. They may prefer one over another, but they still used whatever they needed. So Tianma is the sovereign, Chai Hu, Huangjin, and Huanglian wine process because they're too cold and bitter for such a patient, and wine processing kind of takes the edge off. These are the minister to treat the heat in the upper body. He's got Qian Pi, which is acrid and warm. Zhigan Sao, which is sweet and warm, to supplement the center and boost qi as an assistant to protect the center from these cold bitter herbs. And Xinjiang and Banxia, which are acrid and warm, to treat the wind phlegm. Plus Fuling, sweet and level or neutral in temperature, to promote the flow of water and guide the damp heat downward as the envoy. The patient took several doses, and the evil qi calmed down, and he recovered. Okay, these things in parentheses are in the text. So, okay, ancient doctors used acumoxa even if they were herbalists. The last case for today is from Zhenzhou Dacheng, which was written by Yang Jizhou. It was published in 1601 Ming Dynasty. It's, Zhenzhou is acumoxa, great compendium of acupuncture and moxibustion. But what I think a lot of people don't understand is because I've translated 2 volumes of this book and I've spent a lot of time in this book, it talks about herbs so much. Of course, the emphasis is really on acupuncture, but this book talks about herbal treatment quite a bit. In volume 9, there are a bunch of cases that Dr. Young, treated, and here's one of them. So in 1555, he arrives in some place, Jianning in Fujian province today. He saw the mother of Tang Kushan. So, in the old books, they never use the name of the woman that say the mother of this person or the wife of this person or the daughter of this person. They never use the name of the woman, or they'd say an old woman, or they'd say a young girl that hasn't yet left her family to get married. So this is a mother of somebody. She suffered from inability to raise her arms. She had aversion to cold on her back, and her body felt tired and fatigued. Although the summer was quite hot, she liked to wear a padded jacket. Various doctors had all treated this as deficiency cold. So I should point out that this Tung Kashan must be an adult and maybe even an older person because they're talking about him. If it was a child, they wouldn't talk about his mother. They'd find some other male to relate her to. So if he's already grown, then the mother is a bit older in terms of, Chinese culture at that time. She's not, a girl, she's not a 20-year-old, she's not a 30-year-old. So by the time you get to 40, then that was a little old. Nowadays, not so much, but then that was a little old. So she might be 40 or 50 or 60, depending on how old Mr. Tang is. And so her arms are, inability to raise her arms. Is it frozen shoulder? Is it weakness? Is it a way pattern like paralysis or atrophy? We don't know. It doesn't specifically say, but she also dislikes cold, especially her back dislikes cold, and she feels tired and fatigued. And even though it's summer, she's still wearing a padded jacket, like a quilted jacket. And so Yang Jizhou says, well, what have the other doctors done? And apparently they treated it as deficiency cold, as yang deficiency. And since it hadn't been successful, he knows he shouldn't treat it as yang deficiency. I examined her pulse and found it deep and slippery. This was phlegm in the channels in the wool vessels. So, of course, slippery is phlegm or damp or something like that. And since she has a problem with her arms, then, that's not really an organ problem. Although, of course, to make phlegm, some of the organs must be out of balance. But, the phlegm or the damp is filling up the channels. And so her arms are heavy and she doesn't want to move them. It's not deficiency. It's, phlegm. So the other people looked at her and thought, oh, she's cold and she's weak. It's deficiency of yang. And he read the pulse and said, well, who knows? Maybe she's a little deficient, but there's phlegm here, and that's what we need to treat. So he needled UB13, the lung shu point, and LI11 and stomach 36, the Husi points of the Yangming channels. The same day, she immediately felt her body lighten and she could raise her arms. She no longer feared cold and didn't wear the padded jacket anymore. So, okay, since why UB13, the lung store phlegm, possibly? The lungs are an upper body organ. There's cold on her back, maybe in the specific region of UB13. It doesn't mention anything like cough or whatever. And so, but then why Li11 and stomach 36? Not, Li11 clears heat, but he's not clearing heat. And stomach 36 supplements qi, and maybe that was part of his thinking. But remember, the Yang Ming channels have abundant qi and blood, so they're really good at regulating qi and blood. If you get qi to move, then the fluids will, be also flow, and the phlegm will dissipate. And so these are used as the Husi point of Yang Ming channels, rather than as heat clearing or qi supplementing. Okay, so she no longer feared cold. She didn't wear her padded jacket anymore. And afterwards, then he gave her a formula to eliminate dampness and transform phlegm. And up until today, she is still healthy with no other diseases. And if I had mistaken it for deficiency cold, the more I would have supplemented her, the more the phlegm would have bound her up. Sometimes when, there's excesses and accumulations and you supplement, you make the excess even stronger. How can one not be careful? So, yeah, so you can see he still used an herbal formula here on her, but he got things moving before he gave her the herbal formula. Okay, those are my cases this time.